All right, everybody, I believe we are good to go. Thank you and welcome. Alex, I'll turn it over to you.
Thanks so much, Danielle. Bonsoir, bienvenue à tous et à toutes. My name is Alex Munter. I'm the president and CEO at CHEO, and I'm the co-chair of the Kids Come First health team. We'll tell you what that is in a moment. Et j'aimerais souligner que si vous souhaitez suivre la session aujourd'hui en français, veuillez consulter le site web du Kids Come First. Donc, c'est le www.kidscomefirst.ca, maladie-respiratoires, et vous pouvez rejoindre la session Zoom pour une traduction simultanée. Et si vous êtes déjà en Zoom et souhaitez écouter la session en français, les participants peuvent sélectionner le mode diffusion sonore pour l'entendre l'audio traduit en français. Please note that for today's session, only the MC, that's me, and the panelists will have video. Participants will be muted, but we will be collecting questions just as we've collected questions in advance. During the session, we'll be using Microsoft Form to collect your questions, and a link for how to submit them should appear shortly in the Zoom chat. And for those on YouTube, a link will appear in this video's description. So just click on the link, submit your questions. We are recording this session. I'll make it available on the Kids Come First website after the session. And we will try to answer, there's a lot of questions already submitted, probably more than we have time for. We'll try to answer as many as we can tonight, and then make the information available as well through our FAQ. Of course, I want to remind you as we gather that we begin by honoring the Algonquin people on whose traditional unceded territory we live and work and play. And we would like to acknowledge their stewardship of this land, just as we honor all Inuit, Métis, and First Nations people. So what is the Kids Come First Health Team? It's an organization, it's a coalition, if you will, of 60 different healthcare organizations and thousands of community pediatricians, family physicians, and parents and caregivers working together to improve care for kids and families, and CHEO is one of those organizations, and the host organization, the home base for Kids Come First. So let me introduce our panelists today. So Dr. Kelly Zwicker is a community pediatrician and chief of community pediatrics at CHEO and the University of Ottawa. Dr. Allison Eyre is a family physician from the Centertown Community Health Center, which is one of those 60 partner organizations at Kids Come First. Dr. Sarah Reed is a pediatric emergency medicine specialist at CHEO, works in the emergency department at the hospital. Elise DeFrancesco is a pharmacist, a clinical pharmacist at CHEO, specialized in pediatric pharmacy. And Dr. Jason Brophy is a pediatric infectious disease specialist at CHEO. We're gonna start in a moment with Dr. Brophy, and then move to your questions and try to again answer as many as possible. So over to you, Dr. Brophy.
Thanks very much, and thanks everybody for joining tonight. Hope you'll get some answers to some questions that you're interested in hearing about. So I'm just gonna share some slides that hopefully will help orient us to what's going on. So I'm going to share my screen. All right. Is that okay? Am I projecting well? Okay. So I think it's important that we kind of all speak the same language. So when we talk about respiratory infections, which are the thing that really is plaguing our community across Canada, it really depends on what part of the respiratory tract we're talking about. in terms of knowing what exactly the part of the body that's affected. So our respiratory tract goes from our sinuses all the way down to the bottom of our lungs. It can include our ears. An ear infection would be called otitis. It can affect our sinuses. It can give you sinusitis. We're talking about kids here tonight, and we know that younger children don't have very well developed frontal sinuses here up at the top. They still have the sinuses that are down below, the maxillary sinuses and others. We can have throat and tonsil infections. That's pharyngitis and tonsillitis, respectively. You can have a larynx infection. That's laryngitis. The trachea and the bronchi, which are the main areas of the main big airways, the main one that breaks into two, that's the trachea and bronchus. You can have tracheitis or bronchitis. And then the bronchioles are the smaller airways out into the deep parts of the lungs. And those are when they get inflamed with infection, that's called bronchiolitis. And that's one of the big ones that we're talking about nowadays. And then last, the lung tissue itself and the little air sacs that are at the end of these bronchioles and small airways. If they get infection in those spaces, we call that pneumonia. And so many infections can affect multiple areas at the same time. And so you can have an initial infection that affects your throat and gives you a sore throat, maybe an ear infection, and then it can develop into a pneumonia later. So it can be very complicated, and I have sympathy for the average parent who's trying to understand this when it takes many years for a medical student to learn it too. So these are the types of respiratory infections we can see, but what kinds of pathogens can cause them? So bacteria, fungi, viruses, and parasites, but the main two are viruses, by far the biggest component, and bacteria after that. And viruses or bacteria or both can cause almost all of these types of infections. But the main ones that are circulating right now in Canada are three: influenza, RSV, and COVID-19. And COVID-19 is obviously been on our minds a lot in the last two or 3 years, but it fortunately is playing a bit less of a role right now. But that's not to say it's gone. And it's hard to tell the difference between these viruses when children present with them without having testing, because there's a lot of overlap in how they can look. So let's start with influenza first. So influenza or the flu. And so this is one of those things that we always have trouble trying to explain, in that we hear about kids getting colds and flus, but when we talk about influenza, it's the flu. When a medical professional talks about the flu, we're talking about influenza, whereas many other viruses can cause infections that look like a flu, or people refer to as a flu. But influenza is a specific infection that can cause significant illness. So typically in older kids and adults, influenza A or B, those are the two subtypes, and then there are many different subtypes and strains that circulate each year, can cause an illness that's very abrupt in onset. So you're well, and then all of a sudden you're sick. And it often can cause high fever, headache, cough and congestion, runny nose, sore muscles, sore throat, and sometimes vomiting and diarrhea. So that's what we typically see in an adult or an older kid. In a younger kid, it can be a little less specific than that. You may not see all of these symptoms there, or it may be milder or even more severe. But one thing that we do know with it is it tends to be a bit longer, it tends to be a bit more aggressive. And prolonged fever is not uncommon. And what we've been hearing a lot over the last couple of months in folks who are presenting with the flu, or kids presenting with the flu, is that the fever can last a long time, up to a week or more. But the main things I want you to remember about the flu are: one, it's vaccine preventable. The vaccine is recommended and available for children 6 months of age and older. And the first year that they get it, they should get, if they're under 9 years of age, they should get 2 doses, 1 month apart. And then there's really no contraindication to getting the flu vaccine unless you've had a true allergic reaction to it in the past, or another very severe reaction that an allergist or an immunologist has told you not to get it again. Also important to know is that there is an antiviral treatment that's available to treat the flu or influenza, and that's called Tamiflu. There are other ones available in the States, but Tamiflu is the main one we use in Canada. But Tamiflu isn't the only treatment or the main treatment we should focus on. Managing symptoms is really one of the most important parts of the flu and managing the flu. So managing fever with acetaminophen or ibuprofen, maintaining hydration. Kids often one of the parts that lands them in the hospital is if they get behind on drinking or behind on peeing. And so we really want to make sure that they're drinking well, peeing well. Clearing nasal secretions. So a lot of people get stuffed up and they can't sleep at night, or they're coughing all night because the mucus in their nose is running back into their throats. And so clearing out those airways with nasal saline rinses, or having a humidifier, a cool mist or a warm mist humidifier in the room. Those are all really important. And then some kids and older people will get problems with their breathing and actually have low oxygen and may need to come into hospital for oxygen therapy or support. So that's the flu or influenza. The next one is RSV. So RSV stands for respiratory syncytial virus, but RSV is a lot easier to say. Typically, this one affects younger kids, less than 2 to 3 years of age most of the time. And in previous years, we've seen that almost 100% of kids will have had RSV by the time they reach 2 years of age, because it's such a common virus in that age group. In young kids, though, it can cause this phenomenon called bronchiolitis. So that's those small airways that get inflamed due to the infection. And kids with bronchiolitis will present with fever, cough, congestion, and they can have a lot of breathing difficulties. And so for bronchiolitis in younger kids and viral infections in any age, it's really important to watch for signs of respiratory distress or trouble breathing. So that would be things like nasal flaring, where their nares get really flared out because they're really working to breathe. You can see sucking in, like at the top of their chest or between the ribs or underneath their ribs. We call that retractions. Sometimes they can even be grunting because they're working so hard to breathe. And of course, they can be breathing a lot faster than normal. So for RSV, there's no specific treatment, but again, managing their symptoms is really important. And again, the same stuff I just talked about: fever management, hydration, making sure they're well hydrated, because those secretions in their lungs and in their throat and in their nose, when they get dried up, they're a lot harder to clear. So maintaining their hydration is really important. Clearing out those nasal secretions through suctioning with nasal rinses, and then sucking it out with a bulb or another method, and then again, oxygen when needed. And some kids, a small percentage of children every year will need to be admitted to hospital with RSV. And we know that certain children are more at risk for having a severe RSV infection. Those would be kids who are premature and have had premature lung disease as a result of being born premature, kids who have chronic lung problems of other types, like asthma, or other lung damages, kids with cardiac problems, where they already have a problem with oxygenation. Those are the main ones that we think about in terms of high risk for RSV, severe RSV disease. And lastly, there's unfortunately no vaccine for RSV just yet. There is something that we sometimes refer to as a vaccine, but it's actually immune globulin. So it's taking antibodies produced in another way than in your own body and giving them to babies once a month as an intramuscular injection. And there's a program for giving this RSV immune globulin to kids, but it's only recommended for high-risk infants. So the physicians caring for kids who've had these complications will know to refer them for RSV immune globulin. But there's something coming. There are RSV vaccines that are on the way. There's an announcement this year or this month of a study looking at giving RSV vaccine to pregnant women to protect their babies, because we know that young children under a year especially are most at risk for severe RSV disease. And so these vaccines that we gave to their moms will protect the babies if they do contract RSV disease. And so why is it so much more important, or why do these seem why does RSV seem to affect young children more than older children? In part, it's because of their in part, it's because they may never have seen this infection before, and so they don't have any pre-existing immunity in their first year or two of life. But the other part is their airways. So their airways have a certain diameter, and when you're smaller, the diameter of your airways is smaller. And then if you add inflammation and mucus in there, then it's going to clog up the airway more and cause more breathing difficulties. So really, it's an anatomy issue, at least in part, why we see more severe disease, RSV disease in babies. So one question that we keep hearing about is, why is this year so different? Why is our respiratory season in 2022 so different than in the past? So in a typical year, pre-pandemic, we would see RSV start in late November or December, and then we would see influenza A start, usually in December or January, and then we would see influenza B, the second type, usually crop up around March. And so that would be what we would normally see. But as we know, in 2020 and 2021, there was very little RSV or influenza. So this is an influenza graph that you can see in 2020, very in the green, like flat line. In the 2021, 2022, a little bit of influenza at the end of the season. But now in this respiratory season of 2022, we saw things start up a lot earlier. We saw RSV start in September, October, and really has gone crazy. Influenza A started in October and November, and both cases both have skyrocketed. Fortunately, it looks like RSV has started to level off in Ottawa, where the numbers aren't continuing to go higher, but they are still very high, and that's part of the reason why we're seeing so many kids here in the emergency department and admitted to hospital this year, because of those high numbers. And then, as you can see, the red is influenza here in 2022-23, and you can see it skyrocketed as of a few weeks ago. And so this is what we're dealing with. And so why do we see that this year? One is that because we had no RSV or influenza for 2020, 2021, and 2021-2022 seasons, that means we have a triple cohort of kids who've never seen these viruses before. And so 3 times as many kids as we normally would have who are at risk for having their first infection and having very little immunity to help fight it off. And then you add in the fact that we've lifted our mask mandates, that means that these kids are well, if they're in school or if they're in daycare, then we're seeing more kids coming home with these viruses, maybe older kids coming home and giving it to their baby sibling at home. And with that high rate of infection in the school system and in the daycare system, we're just seeing a lot more transmissions. It's worth saying, though, that we're also seeing more of these infections in older kids too, and severe versions of these infections. And we do see that every year, where you'll see a small proportion who have severe influenza admitted to hospital or even to ICU, but the numbers are definitely higher this year. And the reasons for why we're seeing that in the older age groups aren't quite so clear. And the last thing to say is that this is not just a risk just for viral infections or severe viral infections, but one other thing that we can see is that after you've had a viral infection like influenza and sometimes RSV, that leaves your airways quite inflamed. We all have normal bacteria that are in our respiratory tract, and sometimes they can set up shop in that post-infectious, post-viral setting where there's still mucus and congestion, and so it can set up shop and cause a bacterial infection, so bacterial pneumonia or bacterial sinusitis. We're seeing a fair number of those in the older kids after influenza. So really, these are the types of things that we're seeing this year that's making it a bit more difficult. So I will leave it at that, and I'm sure a lot of the questions that will come up will come back to some of these concepts again.
Indeed. All right. So thanks so much for that, Jason. And we'll move to the questions. We do have quite a few, and so we'll get right into it. And the first one, the obvious one, I've been at Shield for 11 years. We've never seen anything like this in terms of this volume of sick kids. within the emergency department and needing to be admitted, and people who've been at CHU for 20 and 30, 35 years tell me they've never seen anything like it. So the obvious question, how much longer is this going to go on? That's the question on everybody's mind, Dr. Brophy.
Yeah, it's on my mind too. and to a certain extent, it's a bit of a guessing game. We don't really know. We do have smart people who model these types of things and model the number of people who are non-immune and at risk, and model what the rates of infection are. Now, what they saw in the Southern Hemisphere, like in Australia, what's happening right now in Canada, happened in Australia 6 months ago during their winter season. And so it's hard to guess, but most people are thinking that we're going to be in this situation, at least with influenza, probably until the middle to end of January. Hopefully we'll start to see RSV infections. Like I said, it already looks like they're plateauing in our region. Hopefully they'll start to decrease soon, and hopefully we won't be fighting two different high rates of infections, but that's the prediction. But then we'll be dealing with influenza B, so we often see influenza B come up a bit later in the winter season, and so it's not to say that we won't see more of another kind of influenza. And once you've had one, doesn't mean you can't get the other one.
Right. And so when are respiratory illnesses infectious? Can another child who has a respiratory illness but is not showing symptoms pass it on to my child?
Yeah, so that's a good question, and very reasonable given what happened with COVID, where we saw asymptomatic infections and people likely transmitting it within households or within contact circles. In general, we don't think we see that much asymptomatic influenza or asymptomatic RSV. We can definitely see mild infections. And how many times have any of us woken up over the past 2 years with a little bit of a runny nose and thought, do I have COVID? Do I have COVID? I don't know if I have COVID. And I'll wait 6 hours and see if I can go to work today. And so sometimes it's hard to tell, especially with young kids who tend to be stuffed up and have a lot of breathing issues in the wintertime anyway, with the heat on in houses and the dryness in the air. And so yeah, we shouldn't be seeing asymptomatic infections leading to transmission. But again, sometimes it's hard to tell, especially with young kids.
Okay. We'll talk about how to access healthcare, but of course you don't need to access healthcare if you can prevent an infection. And Dr. Eyre, another one of Seller's obvious question, how can I prevent my child from getting sick?
It's an excellent question. And I think we have to look at all the wonderful things we've been doing for the last few years, because we really prevented a lot. But now we need to prevent it while actually living our lives. And so it goes back to a lot of those basic principles. If you're unwell, stay home. If people around you, people want to come over, hey, I have a cold, you should stay away. Keep your kids out of school if they're unwell. Wear masks. I know a lot of kids can't wear masks if they're too young, but if we can around them create a circle that is as safe as possible by ourselves wearing masks, adults wearing masks, it makes a big difference. I think one of the biggest things, washing hands. We all know how to sing all the songs that we wash our hands to, but getting vaccinated, which is something that everyone knows. No child likes to get vaccinated, no parent does, but it's really by far the best way, not just the flu shots and the COVID shots, but also all of the childhood immunizations, and making sure that the adults around them are vaccinated, particularly the seniors with the pneumococcal vaccines, the vaccines for pneumonias. We want to make sure the more we can protect ourselves, the more we can protect our children. So all of the basic stuff, wash hands, wear masks, don't let anyone go out when they're unwell, and vaccines.
Thank you. So speaking of vaccines, Dr. Zwicker, lots of questions about the flu vaccine in particular, and at what age is the flu vaccine available, and how effective is it? Because it does vary. And we had a question about RSV vaccine, but Dr. Brophy answered that. So on flu vaccine, tell us a little bit about that.
The flu vaccine is available for any individual who's 6 months or older. So any baby that's 6 months or older is eligible. And it's important to remember that you need a booster if you haven't gotten it before. So if it's the first year that you've gotten the vaccine as a little one, then you need to wait at least 4 weeks to go get another shot to make it as fully effective as it can be. So this year, the flu vaccine matches pretty well with the strain of the flu that's been circulating. It's about 40 to 60% effective. And it's important to vaccinate your child if they're eligible because it is safe. It's safe to get the flu vaccine. And in terms of the RSV vaccine, there's an injection, like Dr. Brophy alluded to, if you have certain criteria. But for the general population, the flu vaccine is a really important one to consider.
Thank you. What about getting flu and COVID vaccine at the same time?
So it's recommended that you don't get them together on the same day at this point, only for tracking purposes, because the National Advisory on Immunizations in Canada would like to spread out those shots by about a 2-week period, just in case there's a bit of an adverse reaction, like a rash at the site or something that needs to be reported. They want to have the shots spread out by about 2 weeks. There's lots of opportunity in the city to get your COVID vaccines and your flu vaccine. So if you time it properly, you can spread it out by that 2-week period.
Dr. Reed, you're seeing a lot, there's a lot of kids obviously in the emergency department. We're seeing very high volumes there. When should you come to the emergency department, and should people be concerned that it's so busy that they shouldn't go?
Yeah, no, I think we really want to reassure the public that we've made a lot of changes in terms of how we manage the patient flow with these big volumes. And so we're doing our best, and we're able to still see the patients that need to be seen. Unfortunately, it's a bit of a longer wait for some other kids who may not have such a serious illness, but rest assured, we're doing our best, and we know we're experts in treating these respiratory illnesses. We see flu and RSV every year. This year, obviously high numbers, but we know what to do. So I really want parents to hear that. In terms of coming into emerge when your child has one of these respiratory illnesses, I think I usually talk to parents about sort of 3 big things when their child's sick with a virus. And coming back to emerge, we'd really want to see your child if you thought they were having difficulty breathing. So I think Dr. Brophy alluded to this. So breathing harder, faster, pulling in between the ribs or pulling in at the base of the neck, looking like they're, huffing and puffing and working hard to breathe. For sure, we need to see your child if that happens. The second issue is around hydration. And again, just to reiterate Dr. Brophy's comments, for sure, when little kids get sick, they often don't drink well. And so if you have a child that's under the age of 2 and they're peeing less than 4 wet diapers in 24 hours, that would be an indication that they're a bit behind in their fluids, and we'd like to see them. Likewise, for a child over the age of 2, it'd be ideal for your child to pee 3 times in 24 hours. So if you're seeing, more than sort of 10 hours with no pee, that means they're behind and they probably should be assessed for their hydration status. And then lastly, just how your child's acting. So when kids get a fever, I'm sure all the parents listening will think, yeah, my kid looks terrible. Their temperature's 40 and they look like a wet noodle. But when you treat their fever, within an hour or so, your child's active and interacting with you, likes the toy that they usually like to play with. If you've done what you can do at home and your child is still very sleepy and hard to wake, that's the word. The word we use for that is lethargy, and that's always an emergency, and we want to see your child. So again, their behavior, their hydration, and if they're having difficulty breathing, those are the 3 big things with a viral illness that we need to see them in emerge.
And Dr. Reed, I've as you know, at Shield, we've opened up extra beds because there's been so many babies and toddlers that have had to be admitted, and it's you walk through the pop-up ICU and babies struggling to breathe and crying. It's scary, right? And then parents are scared. But I think a really important point around RSV, do they need to be scared of RSV?
Yeah, I mean, we have big studies that have looked at the severity of RSV. Very low percentage of babies have severe RSV requiring going to the ICU or needing extra help or assistance in terms of like a machine to help with breathing. And of course, deaths from RSV in Canada, exceedingly rare, okay, like super, super rare. So we are seeing a higher number of babies and toddlers, young children under the age of 3 with RSV this year. So for sure it's busy, and we're seeing a number of those kids will need to be admitted to hospital. But I really would like parents to know that RSV is not a new thing. It's been the leading cause of hospitalization in children for many years. We are experts at dealing with RSV. We deal with it every winter. It's a lot this year for sure. It's unprecedented, that word that we have heard so much over the last 3 years in terms of volume, but we know what to do, how to support a child who has difficulty breathing, how to support their hydration. And it's usually a fairly short admission to hospital if a child does need to be admitted. So I really want parents to hear that. There's been a lot of scary news, and rest assured, peds emergency physicians and inpatient physicians and community pediatricians and family physicians know what to do for RSV.
Thanks. And before rushing to the emergency department, there are other options. And Dr. Eyre, is one of the things out there is you're not going to be able to get an appointment at your family doctor or at your community pediatrician. That's not always true, right? In fact, that's not usually true necessarily.
Well, no, if you do have a family doctor or a pediatrician, nurse practitioner, please try the office, because I think quite often people think, oh, there won't be anything, but many offices have on call. They have people you can call, and the family docs and the pediatricians locally have tried really hard to set aside some appointments at the end of the day to make sure we can fit in the unwell children. But if you don't have a family doc and you need to go somewhere, there are some clinics that have been set up. There's the Kids Come First clinic, which you can learn about on the website. There's the East End Kids Clinic. There's one in North Granville, an assessment center. One in Renfrew County has a virtual triage and assessment center, and the West Ottawa Clinic Assessment Center is there. And exactly from the message from the Emerge is that this has happened every year. So all of those family docs, pediatricians, nurse practitioners, they are very good at assessing RSV, the flu. They know exactly do, and they can really guide you, and they can really help you to understand whether you need to take your child into the hospital or whether this is something that we can work with at home with extra hydration, bringing the fever down, making it a good environment. So please do try, because there's lots out there.
Thanks, Dr. So Dr. Brophy, a question just in reaction to all the chat. Are these viruses the same as croup?
So croup is another one of those kinds of presentations, a way that a viral respiratory infection can happen. And it's typically caused by certain types of viruses. One of them is para-influenza, but influenza and COVID and even RSV can cause a croup kind of presentation. And that croup is typically a really deep, barky cough. It sounds like a seal barking is the way we typically describe it. And kids can have a lot of difficulty with their breathing with it. And what usually happens is they're coughing so much at home, and then the parent brings them into the Emerge, and because they're taken out in the cool air on their way to the Emerge, they get better. And that's one of the treatments we recommend is cool air humidifiers for them. But yeah, so it's a version of a viral infection that can happen, and a number of different viruses can cause it.
A whole bunch of people now looking up seal barking on YouTube to understand what that sounds like. Okay. Elisa Francesco from the CHIO Pediatric Pharmacy, thank you for joining us. Of course, a lot of questions about medication because of the supply chain problems and the shortages that we've seen. So many sick kids, so little over-the-counter medication. So if a parent, caregiver can't find medication, what should they do?
Thanks for the question, Alex. So as you may have heard, there have been many medication shortages in the past few years, the latest being acetaminophen, which is known as the brand name Tylenol, and ibuprofen, which is known as Advil or Motrin. As with most medication shortages, this is generally temporary as companies increase their stock, and it's really not known how long they will last, unfortunately. In terms of finding supply in the community, speak to your pharmacist. They can generally help you or direct you to the right place. If your pharmacy doesn't have any, you can always reach out to other pharmacies to ask them about supplies. These medications are on allocation, and what that means is that Pharmacists get a small supply every few days to weekly, and it can be even less frequent than that. And you may be able to acquire some this way. One thing that we do ask is only to buy what you need so that all parents and caregivers are able to access medications when they also need it. You can also ask about alternative formulations such as tablets. For the most part, in pediatrics, liquid dosing is preferred due to difficulty or inability in swallowing pills. That being said, there are many strategies that can be adopted to give tablets to smaller children, and these include cutting and crushing tablets. And it's really important to speak with your pharmacist about available options that are appropriate and safe for your child. Determining the correct dose for your child using tablets should be, again, done with a healthcare provider, because dosing in pediatrics tends to be weight-based, and especially for these two medications, it's very easy to make a dosing error and to give either too much or too little medication. There are many resources and charts available through the Canadian Pharmacists Association, and there was also one released by our colleagues at Sick Kids Hospital in Toronto that provides some visual aids in how to cut the tablets. The really important piece for parents is to know your child's weight and the units that you use for that weight. So whether you used kilograms or pounds, because this will help your healthcare provider choose the correct dose. Not all pills can be crushed or split. Some tablets have a coating on them, so they shouldn't be manipulated. If a tablet is indeed deemed safe to split, a pill cutter, which can be purchased at a pharmacy, as well as a pill crusher, are really helpful administration tools. An alternative for a pill crusher is if you have a mortar or pestle at home, which many people use these for cooking, or even just 2 spoons can be quite effective in crushing a tablet. Don't give more than the maximum recommended daily dose. Both of these medications, so acetaminophen and ibuprofen, have a dose plateau or maximum. And what that means is they actually don't work better if you give more. And in fact, your child could be at risk of developing serious side effects, which can, in very high doses, lead to either liver or kidney damage. So overall, pharmacists are medication experts, and they're easily accessible for most people. So really speak to them about availability and dosing for your child.
And pharmacists have been awesome. You know, I reflect on my own experience. I have a 4-year-old, couldn't find over-the-counter medication, children's Tylenol or Advil, but could find infant, which is much more concentrated. And the pharmacist gave me a chart of being, so that I could translate from one age to the other. In other words, how much infant Tylenol to give kiddo to have the same amount of medicine as he would have received through children's Tylenol. So thank you to pharmacists for helping out, and they are available to support. Okay, next question. Who wants to take this one? It's a hot potato. Should schools have Christmas concerts? I don't think they mean in general, different debate, but this week or next. All right, so since I'm going to the Christmas concert at our school, wear a mask. Wear a mask, and don't go if you are ill. A question about a similar kind of question. We want to see family for the holidays, but are grandparents at risk of getting RSV? Okay, I'm not going to answer this one. All right, Jason, I'm just gonna pick somebody. All right, Dr. Brophy.
Sure. I'll take that one. So anybody can get any of these viral infections. It's just RSV tends to cause more severe disease in young kids, but the other age group that you worry about are actually older people or elderly people. Most of the time, you won't, unless you come to the hospital and get a test, you won't know, is it the flu, is it COVID, is it RSV? And for sure, you don't want elderly people getting COVID or RSV, even if they have been vaccinated. So I think the take-home message would be, see previous comment. If you're sick, you should stay at home and not share your germs. Share your love in another way.
Share your love in another way. That's a take-home message for today. Jason, you had mentioned underlying conditions in your presentation. What underlying health conditions are most at risk for severe outcome from the flu? Is high blood pressure or kidney disease one of them, or two of them?
Yeah, so with influenza, it's in many ways similar to the risk factors for COVID. So we see severe outcomes in the very young, like infants under 2 years of age, as well as the elderly. In previous years, in Ontario, we had a flu vaccine that was offered for everybody, but not everybody wanted to take it every year. And so I usually tried to provide folks with my take on who's at the most risk. And if you look at the data, kids under 2 years of age are in pediatrics, in general, the largest group that get admitted to hospital with the flu, and then under 5 years of age after that. And then you also see the ones with other comorbidities like neurologic conditions. So if a child has a seizure disorder or a neurodevelopmental disorder, anything where they're not able to handle their secretions very well in their airways, they are more likely to get hospitalized with influenza. Kids who have chronic lung issues like asthma or cystic fibrosis are more likely to get admitted to hospital with influenza. And then of course the elderly, anyone over age 60, 65, they're at higher risk, and with each decade of life they get at increasing risk of severe influenza disease. I don't think chronic kidney disease or hypertension on their own are specific risk factors for severe influenza, but the other things that can go along with that, like if you have congestive heart failure or heart problems, then those would be risks.
All right. Should I pull my toddler from daycare after having a newborn in order to prevent viruses?
Oh, can I take that one too? Sorry.
Yeah.
I saw that question earlier. I think the question was, they're pregnant and they're going to have a newborn,
Right.
and should they keep their kid home from daycare? So my first thing was, actually there's something you can do right now while you are pregnant, which is get vaccinated. You can get the flu vaccine in pregnancy, you can get the COVID vaccine in pregnancy, you can get the pertussis vaccine in pregnancy, and all three are strongly recommended, because not only is it going to help protect the baby by sending the mom's protection or antibodies that she produces through the placenta to the baby, and they'll stick around for the first 6 to 12 months of life to help protect them from those diseases. But when a woman is pregnant, she has a higher risk of getting admitted to hospital herself with severe respiratory infections. And that's because the baby pushes up on her lungs, and so her lung capacity is much reduced in pregnancy. And so get vaccinated. All those vaccines that I talked about, and then in the coming years, hopefully we'll have RSV vaccine as well. And then in terms of keeping your child at home, I think it's a balancing act. We saw definitely the kids need social stimulation, and children's development was one of the big casualties of the last 2 or 3 years of pandemic. But at the same time, you want to keep your baby healthy. So I think monitoring what's going on in the daycare, if there are kids that are sick, making sure that maybe make sure those kids stay at home, watch your child closely, get your child vaccinated for the flu and COVID as soon as they're eligible at 6 months of age. Like those are the things that you can do. Whether you keep a child home or not, like I think that's a family's decision. If you can afford it and you want to, while the baby's very young, like under 6 months of age, that's probably not a bad decision. It's not a necessary decision. I think it's your decision.
All right, and while we've got your attention, Dr. Brophy, one more. I was told that the COVID vaccine has left kids vulnerable to RSV and other respiratory viruses. However, the individual promoting this couldn't provide any evidence to support this claim. Is this true, and is there such evidence?
Yeah, so this is something that has been circulating on social media quite rapidly over the last little while, that either COVID vaccine does something to your immune system or COVID itself. So I've definitely not seen any data on COVID vaccine leaving you at risk for anything. And knowing what we know about vaccines and the COVID vaccines in particular, that doesn't make sense to me. So I've not seen any data or research to support that statement. The other question, the other wrinkle or permutation on that comment would be, what about COVID infection? If someone had severe COVID infection, does that leave them more at risk? So if you have lung damage from your previous COVID infection, then that's like, if you get another infection after that, then your lungs may not be able to handle it very well. But a lot of the talk that's on Twitter and other social media venues right now is about immune dysregulation, and whether having had COVID infection leads to that immune dysregulation that puts you at risk for these other things. To be honest, I don't think we know exactly what to say about that. We know that certain things like measles, like back in the day, measles, when you had it did leave you vulnerable to other infections going forward, at least in the short term. But for COVID infection, I don't think we know enough right now. So I think the take-home point would be just avoid getting infections in any way you can by getting vaccinated, wearing a mask, staying away from sick people, staying away from people if you yourself are sick.
Yeah, and let's keep measles back in the day, because we have seen measles outbreaks in a number of places in the world, especially most close to us in New York State and elsewhere in the United States, because of drop in vaccinations. So we're talking a lot here about flu and COVID vaccines, but of course, primary routine vaccination for children is really, really important, and just a reminder on those. So I think we've established you don't want to get your medical advice from Elon Musk or from Twitter or from Facebook. Dr. Reed, where can people get useful, accurate information about all of this?
Yeah, I mean, I think it's so important right now to find people you trust, and that, probably avoid crowdsourcing your medical information online, and looking to more reputable sources. So your healthcare provider, right? There's some great websites that are available. I think Danielle's going to put those up. So on the CHEO website, we have a lot of the handouts that we use for patient education. The Canadian Pediatric Society has really good handouts for parents called Caring for Kids. About Kids Health is a really good website out of Sick Kids that has many topics covered in multiple languages. And, Health Canada and Public Health Agency of Canada have good information around vaccinations, for example. So lots of reputable sites online. And I would really recommend families to use the ones you like, and, shop around and see what resonates with you. But those are just some of the ones that we use very often in the department.
Great. And there is somebody here who has asked a question about quite specific to their child and the flu shot, and so we're not in a position here to be able to give medical advice about specific situations. Would encourage people to seek out their own physician if you have a question that's very specific to your child. Dr. Eyre, my son has had a cough on and off now for a month, and I don't know if it is one continuous bug or more than one. What can I do, or should I take him to the doctor?
It's a really excellent question. One of the things we're finding, particularly, a lot of kids will keep coughing. It's because, oddly enough, their lungs take longer to heal than the rest of their body from a lot of these viruses. And it's frustrating and it's scary. Obviously, if your child has asthma, if there's some underlying condition, then you want to treat that. But a lot of times it's just that the kids, that's just their lungs are taking longer to heal. A lot of people find a little bit of honey, if the child is over 1, really helps. You can, if there's more and they're not feeling well, you could try the acetaminophen or the ibuprofen. But on the whole, one of the main things you have to do is keep them hydrated, get them their rest, but there's not a lot of medicine we're going to give for them. And we really encourage people under 6, do not use the over-the-counter medications to talk about the coughs, because they haven't been proved to be able to help the children. So it's frustrating, and it is just their lungs taking a little bit longer to heal than the rest of their bodies.
And you just kind of preempted my question. I was going to, sorry, go ahead, Dr. Reed.
Yeah, I would say for sure. I would totally agree with Dr. Eyre. I think the other thing that we're seeing a lot this fall, and probably the other practitioners will agree with me, is that we're seeing lots of little kids with stacked viral infections. So it's just one thing after another, particularly for kids who are in daycare. This year just seems to be much worse for those little ones who perhaps just started daycare or have not been in for too long and really didn't get exposed to many viruses over the last few years because of our public health measures. And so I've talked to so many families who are just at the end of their rope in terms of that sort of just slightly getting better, and then something new starts, and it's just been back-to-back viruses since September or October. And so know that you're not alone, and your healthcare provider understands and knows what's happening. And if you go in for an assessment, we can rule out anything that might need further treatment. But for sure, as Dr. Eyre said, that prolonged kind of post-viral cough we talk about for a few weeks after a cold is really, really common.
And at least on cough syrup for kids, to Dr. Eyre's point, we don't recommend that. Is that right?
Yeah, so that's correct. So definitely under the age of 6, those products are not recommended. And there's several reasons for this. The first is that there's not that much evidence that these actually work for children. And some of them can actually make your child feel worse due to the side effects. There's also a risk of giving them too much medicine. So if you're also giving them acetaminophen or ibuprofen, and then the cough and cold medication also contains that product, it's very easy to go above the recommended total daily dose on those 2 medications. I know it can be really difficult, especially when a cough is keeping your child awake at night, but coughing can actually be really helpful. It can be a sign that the body's getting rid of the mucus that's irritating that airway, and these products that actually stop the child from coughing can be harmful to children.
Good advice. So we're running out the clock as expected. There's lots and lots of questions, lots of interest. So I'm just going to go quickly around the virtual room here and just ask our experts if there's any last things you want to point out, any questions that you're hearing from your patients that perhaps other people might have on their minds. Dr. Zwicker.
Thank you. I think one thing that's a really common question that I hear in the community is the number of the fever, or how high the fever goes. And I think there's a lot of misconception that the higher the fever is, the more dangerous it is. And that's not actually true. It just means that your body is really, really good at making a fever. And that actually tells me your immune system is working really well to make that fever. So one message that I try to help parents understand is that it's really hard, especially as a mom. I even tell this to myself. Like, try not to be afraid of the fever. A fever is normal, and try to keep your child hydrated and comfortable. And it's only if the fever's been lasting for many, 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 many days. Typically, if it's 5 going on more days, you really want somebody to lay eyes on your child. But the real message is the fever is a sign that your body is doing the work, and try not to be too afraid in the first few days of fever.
Thanks. And Dr. Zwicker or any of the other physicians here, do you recommend the use of nebulizers? Are there kinds of equipment you recommend that people have on hand? Dr. Brophy mentioned humidifiers for the air.
Yeah, so I think some of those measures are empowering for parents, because it feels like they're doing something, which is also really important. So often a humidifier can be really comforting to have in the room. Don't put any extra eucalyptus or Vicks or products in it. Just use like a straight humidifier. Crack the window if you want some fresh air, and then a snot sucker is really helpful, particularly if your child is 1 year or less. They can't have the honey-based cough syrups. And a lot of the reason the cough is there is because there's so much snot. So if you have like a nasal spray, which is actually not too expensive off the shelf, or a Hydrosense, that really cleans out the nose. Kids don't really like it, but after a few uses, they really learn that it helps them and they start to tolerate it. So the humidifier can be comforting. It makes you feel like you're kind of helping, and in some cases it does. And the snot sucker, if your nose is really, really congested, those are 2 helpful tools to have at home.
Dr. Reed.
Yeah, and parents often are quite scared of the high fever because they're worried that their child's going to have a seizure or a convulsion. And I think it's important to know that only 2 to 5% of kids will have a convulsion when they have a fever. They're usually very short. They don't cause any brain damage. They're just a symptom of high fever in young children, sort of usually aged kind of 6 months to 5 years. And so it's, you know, 95% or more chance that your child's not going to have one. So I like to play the odds. So try and be reassured by that. And if they do have one, we're happy to assess your child, but understand that it's a normal phenomenon that we see in little kids.
Thanks. Elise, anything else on medication that you want to make sure the parents with us tonight leave with information?
Yeah, so as we all know, medications tend to taste really bad. It can be difficult for parents to administer these medications. There are some resources available. We're posting a couple of slides to the Kids Come First website for how to mix these medications, especially if you've crushed them in a powder form, into food that tend to taste a little bit better. So in some cases, when the tablets or capsules can actually be opened or crushed, you can mix them into juice, ice cream, and other options like chocolate sauce, always making sure that you check with the pharmacist to make sure that that food can safely be mixed to the medication. It can be reassuring sometimes for parents to know this because there are alternatives and ways to administer these medications to your kids.
Thank you, and you're giving me a cue to do a plug for Kid Care Pharmacy at CHEO, because they can produce flavored medication there for your kids. Number one top seller is, anybody can guess? Grape. So I'll go to Dr. Eyre and then Dr. Brophy. Dr. Eyre, anything you wanted to add that we haven't touched on or that you hear frequently from your patient?
So I just want to really emphasize the thought about keeping your kids hydrated and how really important that is when they're unwell. And sometimes people, we want them to drink and it's hard to. So half apples, half apple juice if you can't go out and get something. But I think one of the keys to remember is that if you've given your child Tylenol or ibuprofen, something to bring the fever down, about an hour later, that's a really good time to try and get them to drink. When they're actually starting to feel better, that's your window of opportunity. And that's when you can get a lot of stuff done. So that's when you really want to encourage the drinking because they're going to accept it. And then the other thing is just a plug for the flu shots. The more we create a protective world around our kids, the more we will keep everyone well. And that does involve us as adults putting our arms out as well, which is unfortunate but true.
All right. And on that note, Dr. Brophy, you've heard comments that flu shots are hard to get, which may be the case in some places, but certainly not in Ottawa or Eastern Ontario, right?
That's right. I was listening to Cross Country Checkup last night on CBC, and a woman from Ottawa called in and said that it took her over a month to get a flu shot for her child. And so there is a way to get flu shots in the community. If you Google Ottawa Public Health influenza vaccination, I went on just before we started tonight, and I was able to find appointments this week at several different clinics across the city. So hopefully that won't be an impediment. It's always nice to go to your own doctor if you can for these things, but if it's going to take 3 or 4 weeks, then please find a place to get it yourself.
Great. So thank you to all our panelists. They're all working extra hard, working overtime these days because there are so many sick kids and there are so many families in need care. So thank you to all of them for taking this extra time to answer your questions. Thank you to all of you for your interest and to, in particular, Danielle Vernoy, who is the executive producer and mastermind of the whole thing. Who put this all together. Thank you, Danielle, and have a great evening.